So good afternoon or good morning from wherever you are, ladies and gentlemen. Welcome very much to this symposium of today on the establishment of African Medicines Agency, progress, challenges, and the regulatory readiness. Today, we are so lucky to have pharmacist Bakani Ncube, who is from Zimbabwe and is currently doing his research work in the University of the Western Cape in South Africa. Mr. Bakani is a Mandela Rhodes Scholar at the University of the Western Cape in South Africa, as stated, and his research is focusing on the implementation of the African Union model law on the medical product regulation and the establishment of the African Medicines Agency. He has worked previously as a pre-registration pharmacist as well as a research analyst. And today we have participants from across 16 countries around the world, and we hope that they will be joining us as we continue. And our participants are coming from across all fields of pharmacy practice. And so we hope to have a fruitful discussion at the end of the presentation. Please feel free to ask your questions using the chat function or by raising your hand and ask them directly here in the forum. So with that introductory remarks, I would like to welcome you, Bakani, to proceed. Welcome.
All right, thank you. I hope you can hear me.
Yes, we can hear you.
All right, thanks. Hi, everyone. My name is Bakani Ncube, as I've been introduced, and I'm an MPharm candidate at the University of the Western Cape in South Africa, where I'm doing research on the implementation of the African Union Model Law on Medical Products Regulation and the establishment of the African Medicines Agency. So what I'm going to be presenting on today is a journal article that my supervisors and I published last year in March. And it was titled The Establishment of the African Medicines Agency, Progress, Challenges, and Regulatory Readiness, and it's available from the Journal of Pharmaceutical Policy and Practice. Please forgive me, my camera is not working. On the day when you need technology on your side, that's where it just decides to shut down. But nonetheless, I'm going to proceed with the presentation as is. Okay, so with this presentation, I'm going to be presenting on some background information into Africa and the regulatory landscape, and also the African Union Model Law on Medical Products Regulation. Here, we're going to be looking at implementation benefits as well as country-level adoption of the African Union Model Law. Also touch on the African Medicines Regulatory Harmonization Initiative and the African Medicines Agency, where we'll speak about the motivation to establish the AMA, the vision and the mission of the agency, the AMA treaty, AMA's value proposition, as well as the functions of the African Medicines Agency. And then we'll conclude by looking at some next steps and key considerations, as well as recommendations. All right, so Africa is a continent that's got 55 countries and a population of about 1.2 billion people. The continent also has a high burden of communicable and non-communicable diseases, which present significant challenges for the healthcare system. For instance, the World Health Organization African Regional Office reports having 11% of the world's population. Yet it bears a disproportionate burden of disease, with 60% of people living with HIV and AIDS and more than 90% of the annual global malaria cases being in Africa. There's also insufficient access to quality, safe, efficacious, and affordable medical products, which poses a significant challenge to public health, and this has been the case for some decades now. Amongst low and middle income countries worldwide, the African region has the highest prevalence of poor quality medicines, with an 18.7% prevalence of substandard and falsified medicines. These challenges have largely been attributed to weak or absent medicines regulatory systems, which include unclear policies, as well as incomplete or incoherent legal and regulatory frameworks. In addition, there are challenges such as high staff turnover and lack of competent regulatory professionals in national medicines regulatory authorities, your NMRAs, as well as poor regulatory infrastructure and ineffective regional collaborations among the NMRAs. We see that all countries in Africa, with the exception of Sahrawi Republic, have an NMRA, or an administrative unit, that conducts some or all expected NMRA functions. However, only 7% of these have moderately developed capacity, and over 90% have minimal to no capacity. Evidently, the lack of regulatory oversight on the continent has wide divergence
Hello, Bakani, are you still there? Sorry, I think the presenter has lost a connection. We shall look to have him back. Sorry.
Hi, sorry, can you hear me?
Yes, we can hear you now.
Okay, sorry about that.
Okay,
Let me just bring this back.
no problem.
Okay, I'll just stop this one again. So I was saying that these challenges have largely been attributed to weak or absent medicines regulatory systems, which include unclear policies as well as incomplete or incoherent legal and regulatory frameworks. In addition, there are challenges such as high staff turnover and lack of competent regulatory professionals in your NMRAs, the National Medicines Regulatory Authorities, as well as poor regulatory infrastructure and ineffective regional collaborations among the NMRAs. We also note that in Africa, all countries have an NMRA or an administrative unit conducting some or all expected NMRA functions. And the exception here is Sahrawi Republic. And also, despite there being an NMRA or an administrative unit that conducts these NMRA functions, only 7% of them have moderately developed capacity, and over 90% have minimal to no capacity. Evidently, the lack of regulatory oversight on the continent has wide divergence, with some countries having robust and functional NMRAs. For example, the NMRAs of Ghana and Tanzania now operate at WHO maturity level 3, whereas other countries have regulatory systems that are virtually non-existent. When I speak about the maturity level, this is the concept that was incorporated in the global benchmarking tool, commonly referred to as the GBT, and is used by the World Health Organization to objectively evaluate regulatory systems. So the GBT allows WHO and the NMRAs to assess the regulatory system's overall maturity. And this is on a scale of 1 to 4. So 1 means that there's the existence of some regulatory system elements, and 4 means that operations are at an advanced performance level and there's continuous improvement. So in Africa, there is no NMRA that operates at maturity level 4, and we have the 2 operating at maturity level 3, like I've mentioned. Over the past decade, the regulatory landscape in Africa has also undergone considerable transformation. However, there are existing and emerging medicine registration issues in Africa, which include the regulation of biosimilars and vaccines, advancements in medical products, clinical trial regulation, and the establishment of clinical trial registries. You have challenges faced with blood and blood product regulation and regulation of medical devices, especially diagnostic agents. There are also reported delays of 4 to 7 years between first regulatory submission to a well-resourced NMRA and final approval in sub-Saharan Africa. Some of the barriers that cause these delays are lengthy processes for medical product registration, their general resource constraints, and failure to also leverage some regulatory review activities that have been carried out by stringent regulatory authorities. The challenge of regulating medical products is also exacerbated by the continent having more than 70% of medical products that are consumed being imported, which fuels illegal drug transactions, and it also contributes to the consumption and circulation of SF medical products. So due to regulatory legislation being created at the national level, neighboring countries within your regional economic communities, your RECs, can have considerably different procedures and systems for regulating as well as approving medical products. Consequently, in cases where the NMRAs receive evidence dossiers that are identical, countries are under no obligation to adopt the regulatory decisions that have been made in another country. The applicants and manufacturers are actually obligated to submit duplicative evidence dossiers to several NMRAs for the registration of medical products in each country where that product is intended for marketing. And so this has time and cost implications, and it also delays patients accessing medical products. The lack of regulatory policy harmonization between countries is among the reasons for backlogs and also NMRA staff duplicating efforts. Additionally, in light of the globalization of pharmaceutical manufacturing, it is very difficult for an NMRA to effectively regulate all medical products on its market. In the present context of linked supply chains, one country is increasingly dependent on the quality and safety systems that are in place in another country. And in some African countries, the availability of essential medical products is potentially delayed by these disparities in legal provisions of key regulatory functions. And this has resulted in the need for regulatory convergence towards a common framework. Therefore, in January 2016, the African Union Model Law was officially endorsed. So next, I'm just going to give a brief overview of what the AU Model Law is all about for people who don't know about it. So the African Union Model Law and Medical Products Regulation was developed and promoted by the New Partnership for Africa's Development, NEPAD agency. And this agency is actually now referred to as the African Union Development Agency, NEPAD, AUDA NEPAD. And so the model law seeks to provide the legislative framework for good medicine regulation at a national level. It is a non-prescriptive model legislation that is meant to streamline regulatory systems and facilitate the overall regional harmonization process. In addition, the model law provides the national legislative framework for harmonization at the regional and the sub-regional level, as well as to increase efficiencies in regional, sub-regional, and also national procedures. The intention here is for it to be domesticated and implemented by AU member states and your RECs, which are the regional economic communities for regulatory systems harmonization, to facilitate collaboration across countries and also to ensure that in countries that are involved in research and development, medical products that hold promise are developed, tested, and scaled up for the improvement of health impact. The AU model law also supports the AU's desire to promote local pharmaceutical production with the goal of public health protection and economic growth, and it supports continental efforts to advocate for and catalyze access to new and innovative medical products for patients who need them. And so through the AU model law domestication process, a country can partially or fully adopt the AU model law so that it is consistent with its own constitutional principles and legal system, and also amend or repeal any inconsistent national laws that are in force. In terms of the benefits of domesticating the AU model law, for African countries without internationally comparable laws, the implementation of the AU model law is expected to have an impact on the national regulatory system, and the implementation benefits can be seen at the technical level as well as at the more general health systems level. So if we look at the broader health system, domesticating and implementing the AU model law can benefit a country because it will ensure that that country has national laws that are up to international standards, allowing the respective governments to catalyze access to innovative and life-saving medical products for citizens. Secondly, implementing the AU model law will support access to health by ensuring medical products are available. It will support in the respective country effective market control for medical products that are in circulation. And also, a country can now have legal provisions at the national level that allow regional harmonization and international collaboration. And this aspect on harmonization and collaboration is very important, especially as we're leading into the African Medicines Agency. And so through AU model law implementation, AU member states can then strengthen national and regional regulatory systems, as well as reduce substandard and falsified medical product prevalence through the enforcement of a provision for SF medical product prohibition. So at the national and regional level, implementation targets that are related to the AU model law were to have at least 3 regions adopting regional policies and legal frameworks for medical product regulation by 2020, and at least 25 countries domesticating the AU model law by 2020. So however, the latter target, which is the target to have at least 25 countries domesticating the model law by 2020, was not achieved. As we note that in April 2021, which is last year, 17 countries were either in the process of domesticating the model law or they had completed the domestication process. So the 13 countries that were in the process of domestication are Benin, Burkina Faso, Burundi, Cote d'Ivoire, Egypt, the Kingdom of Eswatini, the Gambia, Lesotho, Namibia, Seychelles, Tanzania, Zambia, and Zimbabwe. And the 4 countries that actually completed the domestication were Malawi, Rwanda, Mozambique, and South Africa. Another initiative that's worth mentioning before we move into the discussion on the African Medicines Agency is the African Medicines Regulatory Harmonization Initiative. So in response to national medicines regulatory challenges, the African Medicines Regulatory Harmonization Initiative, which I'll be referring to as the AMRH initiative, was formalized in 2009. So its main aim is to create more effective, efficient, and transparent regulatory mechanisms in various African markets through collaborative regional mechanisms that, among other goals, seek to achieve faster medical product approvals. The AMRH initiative intends to expand its scope of work gradually, starting with generic medicine registration and moving towards the oversight of vaccine clinical trials, pharmacovigilance, the registration of new chemical entities, medical devices, and diagnostics. The AMRH initiative also proposes to serve as the foundation for the establishment of the African Medicines Agency, the AMA, which will have the mandate of overseeing the registration of specific medical products and coordinating regional harmonization systems in Africa. Therefore, the AU model law's development has to be interpreted within the context of these overarching efforts towards regulatory harmonization in Africa. All right, so the motivation to establish the African Medicines Agency. As we've seen in Africa, regulatory systems in some countries are better than in others. These regulatory capacity disparities are considered a basis for the establishment of a continental regulatory system. To effectively address some of the challenges that are being faced by African countries, AU member states are establishing the African Medicines Agency. These challenges include implementing agreed procedures and processes, coordinating regulatory practices across sub-regions, priority setting for medical products against select diseases, promoting pharmaceutical manufacturing, and optimally using the Nmra's limited resources. Additionally, Africa has several donors and networks for regulators, which aim to enhance the availability of medical products and serve as opportunities for improving regulatory convergence at a continental level. Therefore, these donors and networks could potentially benefit from the regulatory oversight which the AMA's establishment would provide. Moreover, the alignment of regulatory system strengthening efforts, harmonization initiatives, and advocating for the AMA's establishment are important for optimizing pharmaceutical markets, as well as ensuring the sustainable supply of medical products for priority and neglected diseases. In terms of the vision and the mission of the African Medicines Agency, the AMA's vision is to ensure that all Africans have access to quality assured, safe, efficacious, and affordable medical products that meet internationally recognized standards for priority diseases or conditions. At the continental level, the AMA's mission is to coordinate national and sub-regional medicines regulatory systems, to conduct regulatory oversight of selected medical products, including traditional medicines, and also to promote cooperation, harmonization, and the mutual recognition of regulatory decisions. Before I move on to other aspects, I just want to explain briefly some treaty concepts, as I'll be using these terms from now up until the end of the presentation. So the first term here is the signing of the AMA treaty. So whenever you see it saying that a country has signed the AMA treaty, this is a signal of intent, right? It means that the country is interested in that treaty and would like to join it, but it's not legally binding to that treaty. Sorry, it's not legally binding to that country. And then with ratification of the AMA treaty, this is now formal acceptance by the country of the obligations under the treaty, and it depends on the constitution of the applicable legal system. So we see that you can have an executive ratification or you have ratification by parliament. So in countries where there's executive ratification, the head of state, which is your president, has the authority to ratify, though they may require advice and consent of the Senate, for example, in the United States. And then if you have ratification by parliament, which is the common case in Africa and in Europe and the Commonwealth, with this process, legislature passes the treaty just like any other ordinary law, and then the treaty then becomes binding on that country. And then when we say that a treaty has entered into force, we mean that the treaty now comes into effect. Usually a specified number of countries have ratified in the above way, and they've also deposited their ratification instruments or also their accession instruments. And the last concept here is accession, which is when a country signs and becomes party to an existing treaty that was negotiated and ratified by other countries. So with the African Medicines Agency Treaty, there was a requirement that 15 countries sign, ratify, and deposit the ratification instruments to the African Union Commission. And then the African Medicines Agency would then enter into force 30 days after the 15th ratification and deposition. And then accession is where we're at now, where any country that signs the AMA treaty is essentially acceding to that treaty, which means that they're becoming party to an existing treaty, as that treaty has already entered into force, and it was negotiated and ratified by the first 15 countries. So the historical context of the African Medicines Agency, it actually dates back by a number of years. So we see that in 2010, the 60th session of the WHO Regional Committee for Africa met in Malabo in Equatorial Guinea, and they recommended the establishment of the African Medicines Agency. 2 years later, the report of the AIDS Watch Africa Committee of Heads of State and Government then led to an AU Assembly declaration in which the Council decided that the AMRH initiative shall serve as the foundation for the AMA's establishment. In 2013, there were 2 meetings that were held. The first was the 8th African Vaccine Regulatory Forum, which is ABREF. They met in Uganda, and then you had the AMRC, which is the African Medicines Regulatory Conference meeting in South Africa, and both of these supported the AMA's establishment. We moved to 2014, when the first African Ministers of Health meeting is jointly convened by the African Union Commission and the World Health Organization. At this gathering, key milestones for the AMA's establishment were also endorsed. And then you have your AMA treaty being unanimously adopted by the African Ministers of Health, who were gathered at the 71st World Health Assembly in Geneva, Switzerland in 2018. And also 2018 is the year when the AMA was expected to be launched. 2019, the AU Assembly during the 32nd ordinary session in Addis Ababa, Ethiopia, then adopted the AMA's treaty. And then Rwanda became the first country to sign the treaty as well in 2019. And then last year in 2021, on the 5th of October, 15 countries have now signed, ratified, and deposited the ratification instruments. And like I mentioned, 30 days after the 15th ratification and deposition of the instrument, you have the AMA treaty entering into force on the 5th of November. So we can see that there's actually a 3-year gap between when the AMA was expected to be launched in 2018 and when it actually essentially, became launched, in the sense that the AMA treaty entered into force. So the AMA is being established through a treaty which took into consideration a number of key AU decisions, declarations, and policy frameworks. In the context of moving towards the AMA's establishment, the AMA treaty had to be signed and then ratified by a minimum of 15 African countries, like I mentioned. And ratification, just to reiterate, refers to the national procedure where the member state puts in place a law that allows for the implementation of the AMA treaty. At the start of this year, there were 18 AU member states that had ratified and deposited their ratification instruments to the African Union Commission. You have Algeria, Benin, Burkina Faso, Cameroon, Chad, Gabon, Ghana, Guinea, Mali, Mauritius, Namibia, Niger, Rwanda, Seychelles, Sierra Leone, Tunisia, Uganda, and Zimbabwe. And then 9 countries have signed but not yet ratified, and they're listed. And then you have 1 country, which is Morocco, which ratified, but it's yet to deposit the ratification instrument. And then 27 countries have not signed at all. The AMA treaty is still open to these AU member states for signature and ratification. And for AU member states who accede to the present treaty, the AMA treaty shall be in force in respect to that member state on the date of deposition of the accession instrument. So essentially that means that if a country accedes to the treaty today, for example, the treaty is now in force in respect to that country today. And so some possible reasons for the slow signing of the ratification of the AMA treaty. The ratification process has been slower than anticipated by its proponents. Like I mentioned, there's been 3 years from 2018 till 2021. And some countries with more robust regulatory systems are yet to ratify. Some reasons that have actually been put forward include a lack of political will, which could impede the implementation of regional or continental decisions. Also, misconceptions, particularly at lower levels of integration, should therefore be resolved, along with any differences in policy. There's possibly also a limited understanding of the proposed governance structure and role of the agency, as well as differences in legal systems and requirements across African countries. Other concerns that have been voiced include uncertainties around costs, the implications of ratification, and what the AMA's establishment means for national medicines regulatory authorities. So now the value proposition of the African Medicines Agency. The AMA is intended to be an organ of the African Union that is legally mandated by member states, and it will provide a platform for the coordination and strengthening of ongoing medicines regulatory harmonization initiatives across the continent. It will also ensure optimal use of scarce resources by pooling expertise, capacities, and strengthening existing networks. The AMA also intends to offer guidance in addition to complementing and enhancing the harmonization efforts of your regional economic communities. This should enhance the accessibility of quality assured and affordable medical products. It will also ensure, it will rather enable expedited approvals for medical products that meet the health needs of Africans, particularly for conditions that affect Africa disproportionately. It will foster the competitiveness of locally manufactured medical products, work collaboratively with NMRAs, provide technical guidance, reduce duplicative efforts, and ensure cost-effective use of limited resources. It will also work with technical partners such as the World Health Organization, the European Medicines Agency, and the US FDA. And lastly, the AMA will build on the experiences and strengths of the RCOR model, which is your regional centers of regulatory excellence, as it intends to be an agency that is focused on developing regulatory science specialists. Ultimately, instead of us having 50 plus NMRAs on the African continent, each with its own regulatory requirements, the AMA intends, among other goals, to result in streamlined regulatory processes in order to enable the timely evaluation and subsequent registration of medical products. So I mentioned in the previous slide, regional centers of regulatory excellence. So for people who are not aware of those, I've put up this slide here just so that we're all on the same page. So an RCOR is an institution or partnership of institutions that have got specific expertise in regulatory science, as well as proven capacity and capabilities in the training or delivery of services in at least one of the categories of regulatory and managerial functions that have been identified. So since 2014, the AMRH initiative has spearheaded the designation of 11 RCORs that specialize in 8 regulatory functions, strengthening the development of regulatory capacity by leveraging existing academic, scientific, research, and regulatory institutions. These RCORs are specialized in pharmacovigilance, in the training of core regulatory functions, quality assurance and quality control, medicines registration and evaluation, licensing of the manufacture, import, export, and distribution of medical products, inspection and surveillance, and clinical trials oversight. I know now that there are plans to designate 2 additional RCORs that will specialize in vaccine manufacture and or the regulation of vaccines, as we see that the continent is trying to boost its local production of vaccines and vaccines for COVID-19. In terms of the functions of the African Medicines Agency, the AMA, which will serve as a reference center, that is a coordination and stewardship function for the regulatory activities of African countries, will perform the following as part of its core activities. So firstly, marketing authorization. It will also conduct joint assessments and GMP inspections, market surveillance and safety monitoring, oversight of clinical trials, and also coordination of quality control laboratory services. It is worth noting that the AMA will not replace your national medicines regulatory authorities or the sub-regional medicines regulatory authorities, which will be established by your regional economic communities. Instead, the AMA desires to complement these efforts, the efforts of your NMRAs, your RECs, and even regional organizations that intend to create a conducive environment for the pharmaceutical industry to develop through enhanced coordination of the various stakeholders that are involved in African regulatory harmonization initiatives. So NMRAs are still going to assess the majority of medical products. They'll still have their regulatory decision-making roles, and they'll still put in place market controls for their specific territories. Another thing that's worth mentioning is that the African Union does not have sweeping legal powers over national jurisdictions of member states, and therefore decisions that are made at the continental level are not going to be legally enforceable in AU member states. So now I'm going to speak about next steps and key considerations, and these are just my own reflections. I don't have the answers to these, and I hope that maybe someone can also just chip in here when we have our discussion about some of these next steps and key considerations that I think are quite important. So in terms of next steps and key considerations, the first one is obviously, where will the AMA be located? So invitations have been sent to members of the Conference of the Party to the Treaty to place a bid to host the AMA and 13 bids were received. So when I speak about conference of the party to the treaty, this is essentially the countries that have signed, ratified, and deposited their ratification instruments to the African Union Commission. Like I mentioned, there's 18 of them. So those 18 countries become what is called a conference of the party to the treaty. So they were invited to put in a bid to host the agency, and 13 bids were received. So in order to host the agency, the AU member state must ensure the provision of conditions that are supportive of the AMA's regulatory and coordinating role and be optimal for the agency to execute its mandate. Once all these 13 bids to host the agency have been assessed, the Assembly of the Heads of State and Government will be presented with a report, and they'll decide on the hosting of the African Medicines Agency. And thereafter, the African Medicines Agency will begin operations. I did check yesterday to see when the heads of state are going to be meeting. And the African Union website states that they're going to be meeting on the 5th to the 6th of February of this year. So that's next month. And this will be the 35th ordinary session of the AU Assembly, the heads of state and government session. So we will get more information about the hosting of the AMA in a few weeks. And it will be quite interesting to see which country of the 18 gets to actually host the agency. And I'm also quite interested in seeing the reason, or rather the justification for why that country actually got the bid to host the agency. So in addition to deciding which country will host the agency, there are also other key considerations and challenges that need to be addressed. The first one is transitioning the African Medicines Regulatory Harmonization Initiative, the AMRH initiative, into the AMA, as the AMRH initiative is proposed to serve as the foundation for the establishment of the continental regulator. Secondly, finances. So sourcing finances for the AMA's establishment. It has been estimated that in the first 5 years, the AMA will require a total of $100 million to fund human resource costs and infrastructure and operational costs. And third, moving from donor funding to financial sustainability. And then also obtaining the required regulatory infrastructure and a competent workforce. And fifth, addressing the lack of political commitment within certain countries that could impede the implementation of regional or continental decisions. Can you still hear me? Am I still on?
Yes, we can hear you.
All right, great, thanks. I thought it had disconnected for a second there, okay. All right, so I was saying also, how do we move from donor funding to financial sustainability? And also obtaining the required regulatory infrastructure and a competent workforce, which is quite a challenge on the continent, and addressing the lack of political commitment within certain countries that could impede the implementation of regional or continental decisions, and fostering an environment that is conducive for innovation and the biopharmaceutical industry. And lastly, we need to consider how do we bring together African regulators and the regulated industry. So these are the key considerations that I was thinking of, but I suppose there's other additional ones as well to this. And then in terms of recommendations, like I mentioned, this presentation is pretty much based on a publication from last year that my supervisors and I wrote. And so in it, we had 5 recommendations. The first one was an assessment of the current status of implementation of the AU model law by AU member states, as it may provide a foundation for identifying the existent gaps and opportunities for improving medical product or health technology regulation, public health protection and promotion, and the pharmaceutical industry advancement on the continent. We also recommended an examination of the enabling factors and challenges that are encountered in domesticating and implementing the AU model law. Third, we recommended an analysis of the enabling factors and barriers that are encountered by AU member states in signing and or ratifying the treaty for the AMA's establishment, with lessons also being drawn from Burkina Faso, Ghana, Mali, Rwanda, and Seychelles' experience of treaty ratification. So at that time, those 5 countries were the only countries that had actually ratified, and this was in about September 2020. So in September 2020, those were the 5 countries that had ratified, and we thought that they would offer good lessons for other countries that also intend to sign and ratify. Our other recommendation was a comparative study between the AMA initiative and other continental initiatives in order to draw lessons from their implementation and find areas of applicability to Africa. And lastly, we recommended an investigation of African NMRA's expectations of the AMA, perceptions of their contributions to or in the AMA, and the perceived benefits of the AMA to their respective countries. So recommendation number 4 is in red because we're not going to be looking at that. So we are currently doing, we have conducted these assessments and studies that we recommended, and we're currently doing data analysis on them. So that's objective 1, 2, 3, and objective 5. And we should have the results soon. And it'll be quite interesting to see how those play out. And lastly, with this presentation, I'd like to highlight the key takeaway messages as follows. So African countries face a number of regulatory challenges that we've seen. Notwithstanding, commendable progress has been made over the last decade to address these challenges, mainly through the AMRH initiative and the implementation of the African Union Model Law and Medical Products Regulation. The AMRH initiative aims to create more effective, efficient, and transparent regulatory mechanisms in various African markets through collaborative regional mechanisms that achieve faster approvals, whereas the AU Model Law aims to streamline the regulatory systems and facilitates the overall regional harmonization process. So these 2 initiatives should not be looked at in isolation. They're both trying to bring about regulatory system strengthening as well as harmonization in the region, which was definitely going to be important for the African Medicines Agency. The AMRH initiative is also proposed to serve as the foundation for the establishment of the AMA, and it will be an agency that will ensure effective medicines regulation by galvanizing technical support, regulatory expertise, and resources at a continental level. This is the end of my presentation, and thank you so much for giving me this platform to present this, and also for your time in listening and attending this webinar. I'll hand over to the moderator to guide us on next steps. Thanks.
Okay, thank you very much, Bakani, for this very nice and enlightening presentation. We are very happy to have listened to these important insights which you have shared with us. And I hope members of the symposium have questions and contributions which they would like to add on or to know more from you. So members, the presentation is now open for questions and discussion. And if you have a question, you may raise your hand using the raise your hand function, or you may type it directly into the chat box and we will read it for you. So I already see the hand of Amule, and you may proceed. Just mention where you are coming from and proceed to your question.
Yes, thank you so much, the moderator and the presenter. Bakini, your presentation has been very marvelous, and I personally have been following it, and it's very nice. My name is, as you know, Amule Nixon Raphael. I am currently in Addis Ababa, Ethiopia, and a South Sudanese by nationality. I have bachelor's in pharmacy from Addis Ababa University, and also 3-year certificate in comprehensive nursing from Uganda. I really followed critically what your presentation is all about. And I have a question regarding the level to which the African Medical Agency has reached in the quest for it to be made as an organ of the African Union. And needed to know, for instance, which level, for instance, like, is it going to be passed by the executive, like during the extraordinary heads of state summit, or it's going to be passed through the Pan-African Parliament? And one thing I really appreciate about the quest to have the African medical agencies, because when you look at the African Union, we have the CDC, Africa CDC, we have the AFINET, but there's nothing. We have PANVAC, which was basically a vaccine manufacturing center for veterinary. So there's nothing that is holding in regards to pharmacy and pharmaceuticals or regulatory affairs in the African Union. So I wanted to know which level has this rectification of the treaty for the establishment of the African Medical Agency has reached. Has it gone through the heads of state or the executive, the PRC, or it has to go through the Pan-African Parliament? Thank you so much.
Okay, thank you very much, Mr. Amule. We have a tradition of answering question by question. So Bakani, you may proceed, please.
All right, thanks. Thank you for the question. So in terms of the process, so right now we have the 18 ratifications, like I mentioned, and 15 were required. And so what happens is after the bids are received from the countries that ratified and deposit their ratification instruments, the next step would be to select the host agency for this. And so that decision is going to happen from the Assembly of the Heads of State and Government. So they're going to be meeting next month, like I mentioned, from the 5th to the 6th of February, and that's the 35th ordinary session of the AU Assembly. I hope that answers your question about which level it's at. I'm not sure if after the 35th ordinary session of the AU Assembly, if it's going to go to the Parliament, the Pan-African Parliament that you mentioned, but what I know is that it's going to have to go to the heads of state and government, and then they'll decide. Thanks.
Okay.
Thank you.
Thank you very much. I see another hand from David Mnyemba. You may introduce yourself and ask your question. Welcome.
Well, thank you so much for a very nice and good presentation. I'm David Mnyemba. I'm a PhD researcher at the KU Leuven in Belgium. But I'm from Tanzania, Muhimbili University. I'm a pharmacist and professionally I'm an industrial pharmacist. Actually, I must say that I'm a very big fan of the harmonization initiative of regulatory bodies in Africa. But I have a couple of questions here to the presenter. One is, in your presentation, you say that the AMA will not replace the NMRAs, the National Medicine Regulatory Agencies. But I want to ask, why do we need these National Medicine Regulatory Agencies if we have the African Medicine Agency? So maybe you can elaborate more on that point. But again, I want to know what has been the role, if any, of the big pharmaceutical industries in this drive for the harmonization of African regulatory initiatives. I want to know because naturally, pharmaceutical industries actually incur very large costs when they want to have their medicines registered in every country in Africa. So probably they want this harmonized body so that reduce their costs. I want to know whether there's been any discussions among the different regulatory bodies in Africa about the role of the pharma, and if that has been a stumbling block as well. So those two questions.
Okay, thank you, David, and Bakani, you're welcome.
All right. Thanks, David, for the questions. So the first one is, what's the need for NMRAs if we've got one continental regulatory authority? So I think there's two aspects to this. The first one is obviously that the countries in Africa have got sovereignty, right? So they get to decide what happens in their own countries, and they're responsible for whatever's happening in their own countries. So you do need the national medicine regulatory authorities in place to ensure that the medicines that are within that country are good quality, they're safe, and they're efficacious, right? So I think that's the first thing. You can't have the AU deciding what's going to happen in individual countries when those countries have got their own sovereignty and make their own decisions. The second thing has got to do with the fact that your African countries face different disease, or rather they face different challenges in terms of health, right? In terms of the prevalence of diseases in those territories. So with the AMA, you would ideally want to have a continental regulator that's going to address any issues that all of Africa is facing. For example, if you have COVID-19 and it's affecting the whole continent, right? You would want the AMA to step in and take over that role and provide guidance to your individual countries. Whereas you might have in one country, for example, malaria might be an issue. So that country still has to make sure that it works within that framework of ensuring that the medicines for malaria are actually good quality, safe, and efficacious for their citizens. It wouldn't make sense for you to have a continental regulatory authority then now touching on every single medical condition that's affected by every single country in Africa. So you still want your NMRAs to deal with that on a national level. And you might also have regional economic communities, for example, the East African community. They might face one group of challenges that are peculiar to them. So they can also then have their own East African community regulatory authority that will deal with issues on a regional level, right? And then if there's anything that's affecting all of Africa, then you'll have the AMA coming in with expertise for that. So I hope that makes sense. So those are the two reasons that I can think of. And in terms of the role of pharmaceutical companies, they've been quite active in this process, especially in an advocacy capacity. You might know of the International Federation of Pharmaceutical Manufacturers and Associations, IFPMA. So they have an African regulatory network who've also been actively involved in advocacy and getting the opinions and perspectives of pharmaceutical companies and having those passed on to the African Union, African Union Development Agency and other business partners and technical partners as well. So they have been involved, but it's mostly been on an advocacy role. Thank you.
Okay. Thank you very much, Bakani, for nice answers and replies to those questions. Now we have questions in the chat. One is from Farhan Yusuf, and he's asking what can be done by pharmacists at the grassroots level in different African countries to support the signing and the ratification of the agency by their respective countries. Any lessons or guidance?
All right, thank you for that question as well. I think on a grassroots level, pharmacists have a role to play in terms of advocacy as well. And there's two avenues that I think pharmacists can follow for this. The first is if they use their pharmacist council or the pharmacist society, pharmaceutical societies in their countries to lobby and advocate for the Ministry of Health to essentially bring that the treaty issued to Parliament in their country for it to be signed and ratified. And also you can have the regulatory authorities, which you find have been very critical in most African countries. You find that most regulatory authorities in Africa have got staff who are actually pharmacists. So the pharmacists and regulatory authorities can also use their capacity as the regulator to lobby the Ministry of Health as well to elevate the issue of the AMA to Parliament and also President or Cabinet. So yeah, I think pharmaceutical councils, pharmaceutical societies, and also regulatory authorities are very key in this. Thank you.
Okay, thank you very much. We have another question from Ugasa Magembe, and he's asking, first saying, thank you for the presentation. And he wants to know if at this stage it is inclusive of both human and veterinary products.
From what I've gathered, I think they're going to be focusing on medicines for human use. And this is also going to include traditional medicines when speaking about medicines for human use. I haven't seen anything about veterinary medicines, but I think we will probably know more about whether or not that's being included in a few weeks once the governance structure and functions of the AMA are finalized. But as it stands, I think it's just going to be for human use, and that's going to include traditional medicines. Thanks.
Okay. So members, if you still have a question and you would like to ask it, please remember to type it in the chat box, or you can raise your hand and ask it directly here in the platform. Meanwhile, we have another question from Gilbert Mateshi, and he's asking, is there a way of linking the AMA initiatives with the HTA teams in countries? If yes, how do you see it happening?
I'm not sure. There probably is a way to link the two, but I'm not sure how exactly that's going to happen at this stage. I think HTA will probably be linked with national regulatory authorities. I can't see how it would directly link with the continental regulator, unless if the continental regulator had some form of agreement with the national regulatory authorities, who then liaise with the national health technology and assessment teams. Thanks.
Okay. Thank you very much. And a question maybe from myself, we have this regional regulatory harmonization initiative like in East Africa and other parts of the continent. Do you think there are any lessons learned from the establishment of this regional regulatory harmonization initiatives which can be of use to the establishment of the AMA?
All right, yes, I definitely think that there's a lot of lessons that can be learned from the regional harmonization initiatives. As we've already seen, the AMRH initiative is going to be transitioned into the African Medicines Agency, right? And the AMRH initiative was coordinating the regional harmonization initiatives. So we have 8 regional economic communities in Africa, and of those 8, 5 of them have got medicines related harmonization initiatives. And so the idea is that these existing 5 should somehow be transitioned into the African Medicines Agency, because they're already existing structures that have got lots of lessons and information expertise as well from executing these initiatives for over a decade, I think, because MRH has been around for some time now. So they definitely do offer lessons, and they will be incorporated into the African Medicines Agency. Thanks.
Okay, thank you. And maybe another question also, maybe you mentioned it in your presentation, but what do you think are the major things preventing other states from signing the treaty?
So the main reason that's been mentioned is that these processes are very slow. So it takes time for a treaty to be signed and ratified in most countries. So for instance, you will have the treaty having to go to the Ministry of Health. And then once the Ministry of Health sees it and approves of it, the Minister of Health has to then take it to Parliament. And then from Parliament, it will also have to go probably to Ministry of Foreign Affairs and also your Attorney General to make sure that whatever's in the treaty is in line with that country's constitution. And then from there it goes to Parliament, and Parliament has to meet. And then from Parliament, you get ratification, and then the ratification instrument has to go to Addis Ababa to be deposited. So that whole process takes time, and there's a lot of players who are involved. So countries have said that they're not necessarily against the African Medicines Agency, it's just that it's taking time. So you can have the treaty issue being stuck, for example, at the Ministry of Health level, and it's not being elevated to Cabinet and Parliament, or it can get stuck in Parliament and not go higher. The other issue is that there's worries or other concerns about what exactly the role of the African Medicines Agency is going to be. Is it going to replace NMRAs? Is it going to come and stand on its own? Is it now going to dictate to countries about what exactly they should do? There's also financial issues here. So once you ratify the treaty, you're now part of the conference of the party to the treaty. So I think the other challenge that's making this slow is that countries are not sure exactly what ratification means for them. Once they ratify, what does it mean for them once it's legally binding, especially in terms of financial contributions, because countries are going to have to contribute to the agency. So these are some of the challenges that have been highlighted. And also the governance structure is currently not clear, which is actually quite interesting, because you have this chicken and egg situation where either countries have already signed and ratified and they're now part of the conference of the party. And then so when the first meeting of the AMA is held, they will get an invitation to come, right? And at that first meeting, they'll be part of the decision making and discussions about what role the AMA will take and the shape and the structure and that sort of thing. But then if you're not part of that, you are essentially not going to be part of that meeting, I think. And then to you, the role of the AMA is still not clear, and whatever your issue is with the AMA is still not going to be voiced because you were not invited to the room. So it's going to be quite interesting to see what happens after that first meeting. Thanks.
Okay, thank you very much. Okay, we have another question from Furhan Yusuf in the chat box, and he's saying this might be related to the recommendation that was highlighted in red, but how will the AMA work with the Afcfta?
In terms of how exactly it will work, it's not yet clear. Nothing has been stated about how the two are going to be linked or how they're going to be working, but there definitely is a relationship between the two of them, because the Afcfta intends to basically bring together all of Africa's economies and have one economic market as it is, right? So I think there definitely will be a link between the two, especially once you have also medicines being regulated continentally. There'll also be easier movement of human resources as well as the actual medical products that are being regulated. So there is a link between the two, but in terms of the exact technicalities of how the two are linked, nothing has been stated yet. Thanks.
Okay, thank you very much. And we have a question also from Catherine Roca, and she's asking, what are the costs involved in ratifying the treaty and being part of the AMA?
All right, thank you for that question. I was actually doing some interviews with some experts, from one African country, and they say that there aren't any costs involved in ratifying the treaty and being part of the AMA. So it's just a matter of that country ratifying either in parliament or however their constitution allows them to ratify. The only financial implications or obligations are going to kick in once the AMA is operational, and the country has to contribute towards that agency, either actually in cash or also by contributing their staff members to conduct the work of the agency. Thank you.
Okay, thank you very much. Mr. Amula, I see you have raised your hand again. Would you like to add on? Welcome.
Yeah, thank you. Actually, I wanted to find out if there are structures that will address structures within the African Medical Agency once it becomes an organ of the African Union that will address issues of intellectual property. Late last month, I attended one webinar, which 3 days webinar, which was organized by the African Union CDC on vaccine and COVID-19. And they feel the issue of Africa, our continent, having issues with the intellectual property. You do know that we have several pharmaceutical companies in African, but of course we still have issues of intellectual property. So will there be structures within the African Medical Medicine Authority that will address issues to do with intellectual property, since we do know that African Union still is not owned by Africa, as most of the politicians say, because the West is still have a lot of influence and control over the African Union. So how will the African Medicine Authority handle issues in regards to intellectual property, more especially in the areas of research and development? Thank you so much.
Thanks for the question. I'm not quite clear on what you mean by issues of intellectual property. Do you mean, could you please elaborate on that? Do you mean countries in Africa, companies in Africa breaking intellectual property and the AMA stepping in to address that? Or do you mean intellectual property issues outside in terms of, maybe a product that's been manufactured without the right IP, and then the AMA has to approve that product? So which aspect exactly do you mean about the IP?
Yeah, basically like in the IP, like for instance, in discovery of new chemical moiety, approval, in most cases we have issues, like for instance, in Ethiopia, there was this famous chemist who actually discovered the chemical moiety that was used for killing the molluscites, and then by then it was taken to Sweden, and then the Swedish government wrote back that this chemical is actually very dangerous. So how will the African Medicine Agency handle such issues like licensing some of these IPs and ensuring that there is no this Western dominance in regards to our research and development? Thank you.
Okay, I see what you mean. I'm not sure exactly how IP is going to play into the African Medicines Agency. I know that it was mentioned somewhere that AMA would want to maximize on the TRIPS flexibilities, but that's pretty much all that I've seen about IP. It's just related to TRIPS. I haven't seen anything else about what you've mentioned. But I think that's something that's worth looking into as well. Thank you.
Okay, thank you very much, Amule, for the contribution, and Bakani for the nice responses. I see no further questions in the chat box, unless there is, or I also see no one has risen the hand. We still have 20 minutes of time, so if you have anything, you are free to contribute. It does not have to be a question also. And maybe while we are waiting for those, I can ask Bakani if there are any mark which we should read before the AMA fully becomes operational, or any number of member states can sign and it can become operational.
So we've already reached that mark. So the target was for 15 countries, right? You needed 15 countries to sign, ratify, and deposit ratification instruments. And so 30 days after that, which was the 5th of November 2021, the AMA treaty entered into force. And so now the next step would be to find a country that's going to host the agency. So in essence, the AMA is already operational. We've already reached that mark, and the mark was 15. So now the next goal is, how do we move from the 18 ratifications to having all 55 countries in Africa being part of the African Medicines Agency? Because I think that is one of the goals at this point. Even if the AMA gets established now, you still want all of Africa to sign on board so that the agency becomes more functional and can also start leveraging other things like economies of scale and technical expertise and that sort of thing. So yeah, thanks.
Okay, thank you very much. Okay, so there are a number of people asking about the presentation. We make sure to share the presentation with all of you after the symposium, if the presenter agrees to share it with us. So I hope Bakani will accept our request, and then we will share it with you via the emails. And
okay.
Yes, I see a question here also from John Mercy. What plan do you have to make other African countries a part of AMA? Or let's rephrase it like, are there any plans existing to make other countries part of AMA?
Yes, there are plans to make other countries part of AMA. So I know that there's still advocacy going on from the African Union Commission, and also the African Union Development Agency. So yeah, I think those three institutions, and also some technical partners that have been supporting things like the AMRH initiative. You're looking here at the Bill and Melinda Gates Foundation, there's the World Bank, there's the World Health Organization, and also some stringent regulatory authorities like your Swiss Medic has been heavily involved in African Medicine's Regulatory Harmonization Initiative. So there are a number of players and entities who are advocating and reaching out to more countries to actually sign and ratify and deposit ratification instruments, so that we have all African countries being involved. Also, Honorable Michel Sidibe had been appointed by the African Union to be the special envoy for the African Medicines Agency, and he was going around African countries prompting them and trying to encourage them to sign and ratify so that the AMA gets established. So I think these are all initiatives that are happening, and we hope that we will get to a point where the AMA covers every African country. Thanks.
Okay, thank you very much. Okay, I see a hand from Nmra. You are welcome to introduce yourself and ask a question, please.
Yeah, thank you, the moderator, for the opportunity. My name is Nmra. I am the African Regional Lead for Africa and USP, US Pharmacopoeia. And I appreciate the this chance, this forum to discuss on the upcoming African Medicine Agency. I understand that there are a lot of initiatives that are ongoing to ensure that more countries sign and ratify so that they can be part of the AMA. And I understand that it might take time to get more countries. And unfortunately, there are big countries with a big economy which are yet to sign. Countries like Nigeria, Tanzania, South Africa, maybe Ethiopia and others, which have a bit more stronger regulatory agencies. And on the other hand, we have the MRH, African Medicine Regulatory Harmonization, which I think they will be running in parallel. And I presume that most of the decisions regarding the direction, the strategic plan, and the other things, some will be decided currently by the countries that have signed up, meaning the member states. So I just want to hear your views. How are the inputs and the concerns and other issues that might be beneficial or have the influence of other countries that have not signed, ensure that they are being taken on board while some decisions are being made by among the countries that have signed, that have ratified the treaty, while other countries that have not signed are not part of the decision making in terms of the AMA formation. Or when I'm talking around the strategy plans, the regulations, and other things that are very, very critical for operationalization of AMA. I want to hear your views around that.
Okay, thank you.
All right, thank you for that. So that's what I was also speaking about earlier, that I think it's quite interesting how this is going to play out, because it's sort of like a chicken and egg situation, like you mentioned. So, you know, if you want to be part of the AMA, you have to sign, ratify, and deposit your ratification instrument so that you're invited to be part of the conference of the party to the treaty, and also attend the meetings and that sort of thing, and also even put in a bid to host the agency, right? So you have to do that whole process. And then on the other end of it, if you've got issues with the way that the governance structure of the AMA currently looks, or the way that the treaty is, your voice will not be heard because you haven't been invited to that meeting and you haven't ratified, right? So it's sort of like you need to get ratified and signed so that you're part of that, and have your voice be heard. But if you don't do it, you're still going to keep on having issues with it, because you never gave input to it. So at the last SCOMRA meeting, which I think was in October or November, it was suggested by one of the experts in regulatory affairs that maybe the countries that have not yet signed and ratified, who have certain reservations or input or comments to give, should maybe lobby and advocate countries that have signed and ratified and will be attending those meetings, so that they can get those tabled on their behalf. Alternatively, a meeting should be held before the African heads of state meet up in February, so that, among the countries that are part of AMRH, for instance, or countries that are part of regional medicine sort of harmonization initiatives, they can discuss among themselves what they would like the AMA to look like, the functions, the shape, and that sort of thing, so that once the conference of the party meets, everyone's input is sort of being heard, and it has been discussed on other fora, be it regionally, be it on a continental level on another platform. But it is quite interesting how the current rules are in terms of how the agencies are set up in Africa. So yeah, I think for countries that haven't signed and ratified, the best chance for them to be heard with the current rules is that they need to speak to a country that's close to them to address their issues on their behalf when the meeting does actually take place. Thanks.
Okay, thank you very much. So there is a question in the chat box also from Catherine Roca, and she's asking, whom do you contact at the AMA to receive further information or invite someone to national initiatives like roundtables? Do you have any contact person?
Okay, yes, I will put in some contacts on the chat just now. I'll have to look it up. It's on the African Union website, but you probably won't know where to find it. I'll look it up and then just post it here just now. Thanks.
Okay, thank you. And probably the last question for today is also from Nixon Amule, and he's asking, what is the ratification and the deposition of instruments of the AMA all about? Could you please expand on that?
Okay, so with treaty ratification, right, you start off with a treaty being signed, which is basically a country signaling intent or showing that they're interested in that treaty. And it's not legally binding on that country, right? So you can have, for instance, Uganda signing a treaty that just means that they're interested in that treaty, but they're not legally bound to the treaty. Once the country ratifies a treaty, they are now legally bound by that treaty and whatever is contained in the treaty. And then you move from the treaty being ratified, and this usually happens in parliament in that country, right? And so now you have to take the ratification instrument, which is essentially the document that you signed saying that you agree to be legally bound by this treaty. You take your ratification instrument, which is the document, to the African Union Commission in Addis Ababa in Ethiopia. So for instance, if it's Uganda that's signing and ratifying, they've ratified the treaty in parliament in Uganda, they have to take the document to Addis Ababa in Ethiopia, which is now the deposition of the ratification instrument. And so that's what that is. Ratification is the national process where a country agrees to be legally bound to a treaty and whatever is contained in the treaty. And then deposition is you taking that document to the African Union Commission in Addis Ababa. And then from that, once you get a certain number of countries ratifying the treaty and depositing their ratification instruments, in this case with the African Medicines Agency, the magic number was 15. So 15 countries had to ratify in their parliaments and then take their ratification instruments to the African Union Commission in Addis Ababa. Once you get to the 15 countries, now the treaty enters into force, which means that the treaty is now, it's now a working treaty. The AMA can be established. And any country that now signs or ratifies the treaty after that 15 has happened, like now, that treaty is now, you now say that the treaty is being acceded to. So anyone who now signs and ratifies the treaty after the treaty is entered into force is acceding to that treaty. It means that they are agreeing to be party to a treaty that has been signed and negotiated by other countries when they were not there. Okay, I hope that's clear in terms of how those four are linked together.
Okay. Okay. I see another question here. It's written direct to me, but I will ask it. It's saying, Paul Mashauri, do you have any plans of having a meeting with heads of states or health ministers for countries which have shown difficulties in ratifying the treaty?
I don't have the authority to do something like that. That's way above me. But I think that's something that probably the African Union Development Agency or African Union Commission will have to do at some point to try and get the remaining 27 countries to also sign and ratify and deposit ratification instruments. Thanks.
Okay. Okay. Another question is from David Mnyemba again, and say, who has to sign the treaty on behalf of the nation? Politicians or leaders of the national medicine regulatory authorities?
For most of African countries, it's the president who signs, and then you get either the ambassador of that country who is in Ethiopia, then now depositing the instrument. But at the national level, most African countries need the president to sign, to ratify rather. Yeah, thanks.
Okay, thank you very much. And also thank you for those who are giving comments on the presentation, saying it's a nice presentation. And I hope we all enjoyed the presentation and have so many new insights which can help us further in our pharmacy practice wherever we are. And I would like to thank you again, Bakani, for accepting the invitation to come and share your broad knowledge on the implementation of African Union model law in medical product regulation and establishment of the Nmra to this forum. It was a really nice talk, and we have enjoyed the talk. And I hope you have also tackled the questions very well, and we have even more knowledge from those who have contributed. So thank you very much again for your time and for coming to this forum today and offering your time to present. The presentation will be available to all of you as Bakani has accepted, and we will share to you via email. You can also follow the recorded version of this meeting on our YouTube page and Facebook page a couple of days from now. And Bakani has also published a commentary on the Journal of Pharmaceutical Policy and Practice. And in this commentary, there's a lot of information also about today's presentation. So you can see the link on the chat and have access to this paper as well. And with that, I also like to thank you, all of you, for attending today's presentation and for taking your time to attend and participating and asking questions. And also thanks to our sponsors, the Action Media and the Christian Social Services Commission of Tanzania, for enabling this platform to be able to operate. And also like to remind you to follow our social media accounts so that you can know more about us and about our future meetings. So with that, I would like to end today's symposium and wish you all the best in your activities. Thank you very much.